Hi everyone, and welcome to our company Ubgen, so called as acronym of Ultra Bone Generation. My name is Maura Boggian, and as a scientific advisor and product specialist, my commitment now is to introduce you a slide presentation with following topics: presentation of Ubgen, Grafts features, bone atrophies, our products, and conclusion. So, start with a short chrono story of Ubgen. In 2010, it was born as an idea during a master in business administration of our CEO. In 2013, the company was founded, and finally, in 2016, the first CE certification for our bovine bone graft. In 2017, starting sales in the domestic market, and in 2018, the export department was created. So, who is Ubgen? Ubgen is an organization operating in the biomedical field specialized in bone surgery and dentistry. We produce medical devices related to tissue engineering. Unlike our competitors, who offer only single elements specific to bone surgery, often not even specialized for dental surgery, we have created Otigen, the complete system for product and services working in a sequential and synergistic way, optimizing every single phase of the regeneration process. This means we can offer our customers a unique solution to improve hard and soft tissues regenerative process, making them more predictable. Here's our Otigen system composed of shelter pericardium membranes, rebone bovine bone graft, Actigen, a patented implant coating, and APG, centrifuge machine for blood components. Introduction to grafts. In dental surgery treatments, including bone and tissue regeneration, grafts play a key role. In the choice of the graft, it's necessary to consider two main aspects. First, the origin of the graft. Second, the features of the graft. And different grafting materials there are in dental surgery. We are talking about autologous, autograft, that means a tissue grafted into a new body position of the individual from which it was removed. Then we can talk about homologous, allograft. It's a tissue of a certain species grafted in a member of the same species. Heterologous, xenograft, equine or porcine or bovine animals. It's tissue of a certain species grafted in a different species. And finally, synthetic alloplast, plastic or metal graft, bone replacement such as HA, that is hydroxyapatite, 3-calcium phosphate, bioactive glasses, and prostheses too. Ideal features of the perfect graft. Yes, what the ideal features of a perfect grafts are? First of all, resorbable. That means the capacity of the bone graft to be resorbed by the human body, and then stability, the capacity of the bone graft to maintain its volume over time. And then osteoconductive, the capacity of the bone graft to work as a scaffold for cells and vessels. And then osteoinductive, the capacity of the bone graft to stimulate osteoprogenitor cells and differentiate it into osteoblasts. that are responsible for the creation of new bone. And osteogenetic, the capacity of the bone graft to help the creation of new mineralized bone. So the perfect graft doesn't exist. As in the drawing, it might be a combination of different xenografts. Only the autologous bone combines all the best features. And the gold standard in international scientific literature agrees that autologous bone is the gold standard reference for grafting procedures in guided tissue regeneration (GTR) and guided bone regeneration (GBR) techniques. Depending on the surgical procedures, sometimes the autologous bone is not enough. To spare the patient's autogenous bone harvesting from calvaria, chin, iliac crest. That means a double surgery for the patient and a very long healing periods. Clinician needs viable alternatives to restore the oral functionality to the patients. When are biomaterials required? When bone atrophies need correction. Correction of bone atrophies, that's a lack of bone where there is no more tooth, mainly supports four types of oral surgery treatment. They are 1. Guided bone regeneration (GBR). 2. Block graft, intraoral or extraoral origin. 3. Sinus lift surgery. And 4. Split crest. Let me underline this important concept about GBR. The goal of GBR is to promote new bone formation following severe localized bone losses due to extractions, apicectomies, radicular fractures, in order to place dental implants. Normally, there are large defects, often craters shape or dehiscence fenestration type defects. With the rebone xenograft material, the bone substitute will be occupied and replaced by patient's bone within 6-12 months. This point is a bone atrophy that needs block graft for vertical, see vertical technique on the left drawing, or horizontal bone augmentation as on the right of this slide. It consists in the removal of patient's chin or mandible bone, hip or skull case for wider grafts. The block of bone removed must be shaped and fixed by small titanium screws. To avoid a second surgery or possible complication to the patients, an option is Ubgen bovine rebone blocks. 3. Maxillary sinus floor augmentation, called sinus lift. Surgery treatment to increase maxillary bone volume in the molar teeth area to place dental implants. Treatment consists of rebone biomaterial chips, syringe or vials, shelter, pericardium membrane, Ubgen, and site closure. 4. Split crest technique. It consists in splitting and enlargement by osteotomy of a maxillary or mandibular crest along the profile of the dentulous bridge. Widely used as minimally invasive technique, avoiding discomforts to the patient. Treatment: rebone biomaterial chips, syringe or vials, shelter, pericardium membrane, Ubgen, and site closure. But bone graft materials are required even after a single or multi-rooted tooth extraction. Scientific evidence-based approach shows GTR, guided tissue regeneration, as predictable in intrabony defects, see Trombelli and Reynolds and al. To obtain new bone formation and a reduction in probing depth, bone graft materials are required after a single or multi-rooted tooth extraction. Treatment: 1 to 3 volts bone defect, use rebone granules and shelter pericardium membrane, and then closure, site closure. Our products. Mainly, we will talk about bovine bone substitute, rebone name, bovine pericardium membrane, shelter. Rebone. Rebone is the first bovine bone substitute processed at low temperature. Very important, this point. Made by a totally Italian production chain that has obtained all safety and CE certification of cattle born, raised and bred in Italy. Our unique production process called Thermagen solves all the issues deriving from high temperature processing. The unique one in the international market, let's say till today. Unlike our competitors who either produce bone substitutes of bovine origin treated at high temperature or do not use a bovine raw material, we do combine the winning features of xenograft material with our unique production process. So, our production process, Thermagen, phase 0, that means pre-treatment. The bovine femurs are carefully selected by our ISO-certified slaughterhouse. A maximum age of 24 months of cattle born, raised and bred in Italy to exclude BSE transmission risk. Phase 1 about Thermagen process. Preparation. Basic cleaning and cutting blocks stored at 20 sub-zero Celsius degrees. Each lot consists of 2 femurs. Phase 2. Cleaning. Processed in ISO 7 clean room. Soft tissue removal and decellularization passages with a thermic shock 80 sub-zero Celsius degrees up to 121 above 0 Celsius degrees. Breaking DNA chain. Chemical reagents. Washing to preserve the natural matrix and its porosity, avoiding ceramization. Prions, decontamination and bleaching. Phase 3, final, getting marked shape, freeze drying process, final packaging in vials, syringes or blocks, gamma rays sterilization in double blister. And finally, the quality controls, analysis of bone substitute composition by ER spectroscopy. Cytotoxicity test ISO as per guidelines, and cell viability test by MTT analysis. Key benefits of rebone. Biocompatible and nanostructured, allows neoangiogenesis, volumetrically stable, shortened rehabilitation time and rough surface. Mainly, rebone is a bone substitute that is very similar to human bone tissue. Therefore, it allows the creation of a favorable environment to the chemiotaxis, osteoblast proliferation, and neoangiogenesis. genesis thanks to the maintenance of extracellular matrix. The presence of internal cracks in the granule, as you can see in both pictures, allows cells and vessels to colonize the graft in depth, shortening the time of resorption of the bone substitute. Rebone clinical application. Maintenance of the alveolus and the bone crest, sinus lift surgery, horizontal increase in two-wall defects, vertical increase in two-wall defects, deficiencies and fenestrations in peri-implant lesions, periodontal regeneration in intra or infraosseous defects, and two- or three-wall furcation defects. Here is a short comparison with the main competitors that are Bios by Geistlich and Cerebon by Botis, now a Straumann company. So, composition. Rebone, Ubgen, is made of 30% of cortical bone and 70% of canceller bone, versus competitors that they only say bone mineral pure phase. Structure, macro and micro porosity respecting pores measurement as per updated bibliography concept, 200 up to 700 microns. And then processing phase, very important. Ubgen used the slow temperature process, maximum 121 Celsius degrees to avoid ceramization. Competitors use heating process as from 600 Celsius degrees up to 1200 Celsius degrees. No natural bone matrix preserved, but a ceramic material as a result. Any porosity. Resorption time, 6-8 months, we say, remodeling into new bone within 12 months. And finally, another difference is about shelf life. 5 years shelf life for rebone of Ubgen, from 5 up to 30 Celsius degrees versus 3 years shelf life of competitors from 15 up to 25 Celsius degrees. And we are almost at the end of this slideshow, and now take a look to our shelter membrane. Shelter is the first Italian bovine pericardium membrane specifically designed for bone surgery in dentistry by cattle born, raised and bred in Italy. We have developed two types of membranes with different resorption time. Shelter fast, 4 to 6 weeks, and shelter slow, 4 to 6 months, and cross-linked. We use the innovative pericross production system. Shelter membranes are designed to promote osteoblastic and periodontal ligament cell proliferation, protecting the site from soft tissue colonization. Shelter fast is a membrane with fast resorption time for 6 weeks, thanks to its broad textured collagen structure. The production process of shelter allows to maintain the reticular structure of the collagen matrix, conferring a certain porosity after degradation. Shelter slow is a slower resorption time membrane for 6 months due to a modified three-dimensional structure of collagen fibers called cross-linking. They are more resistant because of intensified bonds. Shelter slow resorbs in longer time than the fast version and other pericardial membranes available on the market. Shelter slow, unlike shelter fast, is more rigid, resistant, and it preserves its properties of elasticity and very good handling. Features of shelter membrane, that's bovine pericardium, unique production process called pericross, decellularization process by natural chemical reagents and by osmosis, prions inactivations, different thicknesses, 0.2, 0.4, 0.8 millimeters, gamma rays sterilization, and room temperature storage 5 years, from 5 up to 30 Celsius degrees. Benefits of shelter membranes: they are easy to apply, wet and dry. It fits perfectly around the defects. Moistened, it does not stick to the gloves nor to the surgical instruments, in order to spare a lot of time for the clinician. No forehand or backhand, any side is correct. Easy to handle. It accepts any fixing system as sutures, pins, mini screws, titanium screws, and so on. Excellent tensile strength. Stability. Natural 3D guide for cells and blood vessels. Angiogenesis is supported. New blood vessels formation. Chemiostatic ability of attracting fibroblasts, soft tissues healing even in case of post-op dehiscence, and shelter clinical applications. Support of the alveolars and the bone crest, sinus lift surgery, horizontal increase in two-wall defects, GTR and GBR surgeries. Vertical increase, we are talking now about clinical applications. Vertical increase in two-wall defects, deficiencies and fenestrations in peri-implant lesions. Periodontal regeneration in intra and infra-osseous defects and two or three wall furcation defects. Versus competitors. Unlike our competitors, who generally either offer collagen-based materials extracted from other tissues or use pericardium of other animal origin, we exploit the benefits of the bovine pericardium to act as a natural protective barrier. Thanks to its higher percentage of collagen and a high resistance compared to the porcine or equine one, today it represents the gold standard. For our customer, this means having an elastic membrane highly resistant to traction with a greater chemioectrant function, a high stability, and naturally colonizable by cells. Thanks to pericross production process, which makes the membranes resolvable in longer times than normal pericardial membranes on the market. Conclusions. Today, we are the only company that processes Italian bovine xenograft by Thermogen, our low-temperature production process validated with European Community certification. Second, our special pericross production process allows us to be one of the few companies on the market offering different resorption time of bovine pericardial membrane. We place ourselves on the market not only as a company that creates and markets products, but even before as promoters of a project based on scientific dissemination and global communication. We have created Ubgen, the complete system of products and services working in a sequential and synergistic way, optimizing every single phase of the regeneration process. Hope to see you soon. Grazie. Thanks for your attention.